Hello students, today we are going to study about management portion related to breast tumor or breast cancer. Okay, so let's go. We will start our today's session. Treatment for breast tumor. So the main breast cancer treatment option may include, there is having lots of option for the breast tumor or breast cancer. First thing is surgical management, radiation therapy. Third, biological therapy is also called targeted drug therapy, hormone therapy and chemotherapy. Okay, so this kind of option available for the breast tumor or breast cancer. So let's go, we will see one by one. First, surgical option for the breast tumor. So there is having lots of surgery for breast cancer. Like first surgery is lumpectomy, now second mastectomy, lymph node surgery. In comes under to lymph node surgery, there is having two type of surgery: sentinel node biopsy and axillary lymph node dissection. And then next surgery is breast reconstruction surgery. Okay, so now we will see one by one related to surgery. First surgery is lumpectomy. So student, tomy means what? It means removal of particular part in our body. It is comes under to tomy. So here which kind of part we remove by the surgery? Breast conserving surgery or partial segmented mastectomy, and surgically removing the tumor and a small margin of the healthy tissue around it, followed by the radiation therapy. So in this condition of lumpectomy surgery, we just remove the partial part and the affected part of the lymph node, and this kind of surgery is performed and followed by the radiation therapy. Okay, so it is related to lumpectomy surgery. Now second surgery is mastectomy surgery. Mastectomy surgery means, student, it is surgical removing the breast and other infected component. Mastectomy is divided into three kind of section. First is a simple mastectomy, modified radical mastectomy and radical mastectomy. So basically this kind of surgery we perform in the duration of the breast cancer or breast tumor if patient is not able by taking the hormonal therapy and radiation therapy, chemotherapy. That condition we perform surgical management, and it is a main important surgery for the breast tumor or breast cancer. What we do this kind of surgery? So we just remove part of the breast tissue, affected part of the breast tissue, basically in this condition of mastectomy, by the surgical incision in surgical opening in the site of breast. Okay, so it is related to mastectomy surgery. Now mastectomy. What is simple mastectomy? Simple mastectomy means removing the lobules, ducts, fatty tissue, nipple, areola and some skin. So this kind of area basically we remove by the surgical incision in the site of breast. In which kind of surgery? In the surgery is simple mastectomy. Okay, if we perform simple mastectomy, so we just remove that this particular parts. Now second mastectomy, modified radical mastectomy. So if we are perform modified radical mastectomy, so which area basically remove? Simple mastectomy combined with the removal of the axillary lymph node. Okay, so if we are removing the simple mastectomy parts, so as well as with this thing we also remove the lymph node, axillary lymph node, in the condition of modified radical mastectomy surgery. Okay students, now third thing is radical mastectomy, a simple mastectomy combined with removing the lymph node and muscles of the chest wall also. So we remove some parts in comes under to simple mastectomy, as well as we remove of the lymph node, as well as also chest wall muscle also removed by the radical mastectomy surgery. Okay, so this kind of thing is components related to mastectomy surgery. I hope you all are understand related to this particular thing. Okay students, let's go, we will see next thing, lymph node surgery. So it is also one kind of surgery for the breast tumor or breast cancer. So there is having two type of lymph node surgery. First thing is axillary lymph node dissection. So about 10 to 40 lymph nodes are removed by this kind of surgery, usually done at the same time as the mastectomy or breast conserving surgery. So axillary lymph node surgery dissection we just perform with the combination of the mastectomy surgery. Okay. Now second kind of lymph node surgery is sentinel lymph node surgery, is used to determine if cancer has spread to the lymph node under the arm without removing many of them. A blue dye radioactive substance is injected in order to identify the sentinel lymph node which drains lymph from the tumor. They are then removed. So basically what we do this kind of surgery. So we just perform this kind of surgery if cancer and tumor is spreading in the lymph node under the arm. Okay, so that condition we perform this kind of surgery, and this kind of surgery is followed by the radioactive substance, and as well as this kind of surgery is basically performed in the site of lymph node in the area of arms, and drain out particular affected part of substance by this kind of surgery of lymph node surgery. Okay, so it is also one kind of important surgery for the breast tumor or breast cancer. I hope you all are understand. Now we will see next thing. Next option for breast tumor or breast cancer is radiation therapy for breast cancer. So basically if we think common words related to radiation therapy, so what we do, we just provide some ultraviolet rays in the condition of radiation therapy. Okay, so radiation therapy is a treatment with high energy rays such as X-ray or particles to kill cancer cell. The patient may require 3 to 5 census per week for the 3 to 6 weeks. The type of breast cancer will determine the type of radiation therapy used. So basically, a student, in this condition of radiation therapy, if we perform radiation therapy for the patient of breast cancer or breast tumor, so that condition we just provide high energy of rays. Which kind of rays? X-ray rays. Okay, means ultraviolet rays. And then after what is helped by this kind of radiation therapy, so we just kills out the cancer cell, particular cancer cells in the located area of breast, and this kind of radiation therapy we just provide 5 sessions per week. Okay, so it is related to radiation therapy. It is also helpful therapy for the breast cancer or breast tumor. Not only for the breast cancer and breast tumor, but it is all kind of tumor and cancer is helping. Now chemotherapy. Chemotherapy is a pharmacological therapy for the breast cancer or breast tumor. Chemotherapy, chemo is that use of cancer killing drugs. Chemo means it is used for cancer killing drugs. So if we are providing chemotherapy, that condition we are also capable to kill the cancerous cell. Okay, it is given by intravenously, given as a shot or taken as pill or liquid. It is a form for giving this chemotherapy medicines. Okay students, they enter to bloodstream and reach most parts of the body, combats metastasis and damage some normal cells. Sometimes this kind of drug is have a chance to the damage some normal cell also by the giving of the chemotherapy drugs, and it is also one kind of side effect. After the giving of chemotherapy, this kind of problem have a chance to happen that particular person. Okay, and this type of chemotherapy directly enter into the bloodstream, and then after that kind of chemotherapy drug is interfering of the cell development. Which kind of cell development? Cancerous cell development interfering kind of action doing after the giving of chemotherapy drugs. Okay, so it is related to chemotherapy drugs, students. Now next is hormone therapy for breast cancer. So it is also very important kind of therapy for the breast cancer, breast tumor, used for breast cancer that are the sensitive to hormones, and this type of cancer is often referred to as ER positive, estrogen receptor positive, and PR means positive progesterone receptor positive cancer. So estrogen and progesterone promote cancer growth. Basically, if person have a chance to alter estrogen and progesterone hormones, so that condition that person have a risk to which condition? For which condition? For the condition of breast cancer. That's why we are giving to hormone therapy for maintaining the estrogen and progesterone hormone. Okay, so it is also one kind of important therapy for the breast cancer tumor or breast cancers. Now, hormone therapy for breast cancer drug used to block estrogen. So this kind of drug comes under to hormone therapy, basically block for estrogen hormone. Like example, tamoxifen, dormifene. It is also called Firestone and fulvestrant. So this kind of medicine is basically comes under to estrogen block hormones, and if person suffer by estrogen problem, so that condition we are just providing this kind of hormone therapy. Okay, now hormone therapy for breast cancer drug use and changes hormone level. So this kind of drug also given for the changing of hormones in duration of breast tumor or breast cancer. Like example, aromatase inhibitor drugs stop fat tissue from making the estrogen for after menopause. Okay, so it is help for the stop tissue making for the estrogen hormone after the menopause if we are giving. So that condition we are capable to perform this kind of function for that particular person. Okay, now second, luteinizing hormone releasing hormone. So LHRH analogous shut down the ovaries. It is also helpful for the preventing and treatment of the breast tumor or breast cancer. Just give this kind of hormone therapy we just provide and shut down in the ovaries part. Okay, then after we are capable to treat that particular person and mutation of the hormone like progesterone hormone or estrogen hormone. So it is also comes under to hormone therapy for breast tumor or breast cancer. So it's all about the management related to breast tumor or breast cancer. I hope you all are understand. Thank you for listening me. If you have any doubt, students, so please ask me. Okay.